Hello everyone, my name is Daniela Testani. I am a second-year master's student in Health and Rehabilitation Sciences at Western University. Today I'm going to be speaking to you about investigating physiological determinants of mental health in children with cerebral palsy. Cerebral palsy is the most prevalent and most impactful long-term neuromotor disorder in children, and it affects 2 in every 1,000 infants. CP is usually characterized by loss of motor control due to disruptions in the brain during early childhood development. Now, CP is known for being a non-progressive disorder, meaning that it doesn't get any worse, but it also doesn't get any better. Today, I'm going to explain to you how there are physiological risk factors that can have progressive effects on a seemingly non-progressive disorder, and that's by way of mental health outcomes. We know that kids with CP experience a whole host of other impairments along with their loss of motor control, and these all have a detrimental effect on their mental health. We know that namely, pain, fatigue, and sleep disturbances all carry the same negative effect, but we don't know what that looks like systemically. In addition, we wanted to look at physical activity. Now, physical activity is known for being a positive additive to mental health treatment plans, but again, we don't know what that looks like in kids with CP. If we can determine if pain, fatigue, or sleep disturbances contribute the most or least to mental health outcomes, we can then target them in future interventions. And we're really trying to look at this kind of opposing relationship between pain, fatigue, and sleep and physical activity. In terms of our participants, we are still in the recruitment phase of our study, but we hope to recruit 50 participants so kids and youth with CP, from Alberta and Ontario Health Services. Since our study can be done completely remotely, we're able to recruit different participants from more remote areas of Ontario that we wouldn't normally recruit from. In terms of our methods, you can see here on the right side of the screen, since everything is done remotely, everything can be done online. So our consent, our physiological risk factor data, so our daily visual analog scales, and our mental health outcome measures all can be done through the REDCap survey platform, as well as through Zoom for our mental health assessment. In terms of our physical activity data, we are looking at actigraph data. So if you've ever worn a Fitbit, so tried to reach your 10,000 steps a day, tried to get your 8 hours of sleep, and you know that's never going to happen, that's exactly what an actigraph does. And we'll be using that for our movement data, so physical activity and sleep. In terms of our hypotheses, we expect to see, as this is in other populations, that kids that are more active, engaging in more physical activity behaviors will have that decreased incidence of those physiological risk factors that I mentioned, and thereby decreased incidence of mental health. And conversely, but intuitively, a decreased incidence of physical activity, so kids that are not as engaging in as many physical activity behaviors, will have an increased incidence of those physiological risk factors and an increased incidence of mental health. These are some of our preliminary results from our actigraph data. So you can see here, this is our physical activity data. On the right side, the farmost right side column, that these are days meeting physical activity guidelines, Canadian physical activity guidelines. So we know that normally physical activity guidelines for children and youth are 60 minutes of moderate to vigorous physical activity per day. So we wanted to see if any of these children are meeting those guidelines. As you can see in the purple bar, so participant number 26, is probably less ambulatory and not engaging in as many physical activity behaviors, and they're meeting 0 of those 7 days. And you can see that visually in the graph below, compared to someone like participant number 31, who is reaching 7 of those days, so it was probably more ambulatory. And you can really see the difference in terms of their physical activity between those two, between the two graphs. And again, this is just our preliminary data. It's a brief snapshot of our physical activity data. So what are the implications of this? Why does this matter? Well, for researchers and clinicians, we know that creating mental health interventions for children with CP are few and far between. So if we can target these physiological risk factors that are modifiable, we can then give them an optimized quality of life and tailor our interventions not to be so much from a psychological perspective, but really a holistic perspective. So targeting that physiological aspect. And most importantly, for children and their families. Children and adolescents with CP, 57% of them will experience a mental health diagnosis in their lifetime, which is far too many. So it's up to us to create mental health interventions that are tailored specifically to them and can give them that optimized quality of life. Thank you very much for listening to my presentation. I'm happy to take any of your questions. Thank you.